Jamie, what do you think the post-COVID world's going to look like for healthcare?
Yeah, it's a good question, Gary. We're all looking forward to it, first and foremost. And I think there's a near term and a more medium term. In the near term, I certainly hope that people have more confidence in the healthcare system. They can go and start to visit their GPs and their physicians again. And the reason I mention that is that diagnosis has fallen terrifically in the last 18 months. And that's very, very important for catching things early. So that's the first thing. I think secondly, mobilisation of workforces. Certainly in the US, the healthcare workforces are under terrific pressure. So hopefully there'll be a release there. But then as we look further on, there's been lots of people who've had to cancel what we call an elective procedure, so that might be a hip or a knee. And so there's this huge backlog, and hopefully in that post-COVID world we can work our way through that backlog and people can start to address their challenging needs.
What themes are you particularly interested in now in healthcare?
Well, there's a number of themes that we've been focused on in recent times, and three of them we think have really accelerated through COVID. And so I'll just walk through those. The first one is this idea that you can completely disrupt how healthcare is being delivered. And what we mean by that is, can you offer someone treatment for their ailment in a lower cost setting? So rather than a hospital, can you perhaps do that in an outpatient facility? Can you do that in a centre where you walk in, you get your procedure, you walk out, and ultimately can you do that at home? So that's one theme. Another theme is outsourcing that we think's accelerated through the COVID-19 pandemic. That may be a pharmaceutical or a biotechnology company that outsources clinical trials, for example. So they'll go to a business who will find the sites, find the patients, run the studies for the companies and do the analysis. And also manufacturing, something that's been outsourced more and more now, and that also accelerated. And then the final theme that we think has accelerated during the COVID-19 crisis has been prevention. And obviously it's not just vaccines, and I think hopefully we will understand the value of a good, safe vaccine. It's actually also diagnostics. We've seen an acceleration of infrastructure build. Can we now use that infrastructure to expand menus and get more diagnostics done? And that's really important, because if you can catch something early and get a patient on the right treatment path, then hopefully the outcomes can be much better. So they're three of the themes that really we feel have accelerated. Three of the other themes we're really interested in, we have to be honest, and probably haven't accelerated through COVID-19, and they are innovation. I think healthcare is a highly, highly innovative industry. Another one is emerging markets. I think they're going to be an important source of growth for the healthcare industry in the medium term. And then finally, consolidation. Fragmented, strong balance sheets. We do think that consolidation will be a theme, but obviously it's impossible to work out the timing and who the participants are. So I would say they're the key themes that we're focused on.
You referenced timing. Why should an investor consider healthcare now?
I would say three words and then I'll elaborate. Fundamentals, popularity and valuation. So on the fundamental side, I've just touched on some themes that we're looking at, and we really feel that there's an acceleration of growth there, and importantly, durability of that growth. So we think that the fundamentals of healthcare are in rude health. The second one's popularity. We do feel that the sector's unloved at the moment and possibly also under-owned. And so it's slightly contrarian, which can reap quite attractive rewards if you can get your timing right. And then finally, valuation. If you look at the US, on a relative basis, healthcare does scream as attractive, and on an absolute basis, it's broadly in line with been for the last 20 odd years. So all three of those elements we think are certainly the catalyst for an interesting conversation about healthcare.
Wonderful, thank you.
You're welcome.